Hi everyone. Our demonstration today will be on cold moist therapies. The first thing you want to do is check your doctor's orders, check your policy and procedure manual, make sure you do good hand hygiene, and when you enter the room you want to ID your client. So ask them their name and their birth date and verify that with the band. Make sure that your bed is at a good working height, that you provide privacy, and that you explain to your client what you're about to do. For this procedure, I'll be using a medical aseptic technique. So for this scenario, my client has gotten a burn to the top of their hand, so a steam type burn. The skin is very red and the client's complaining of a lot of pain. The skin is still intact. There is some blistering on there, but the blisters are intact and they're not open. So because they're not open, I can use just a clean technique. If the blisters were open, if the skin was raw and bleeding, I would have to use a sterile technique. I'm going to look at what the benefits are and the disadvantages of using this type of treatment. So cold moist therapy is going to conform well to the area that I'm going to be treating. As well, it's going to absorb deeper into the skin. It's not going to dry out the skin, rather it'll add moisture to the skin. A disadvantage is that it can cause maceration. I can cause frostbite. If my client has a cold allergy, it can cause hives. I'm going to assess factors that might affect tolerance, such as their age. So very young, very old may not be tolerant to this treatment. Any type of peripheral vascular disease, and their ability to communicate with me in terms of pain and things like that. Conditions that might contraindicate this treatment, so anybody with Raynaud's disease, a cold allergy, peripheral vascular disease, diabetes, all of these things might be contraindications to this type of treatment. Again, I've done an assessment of the skin and I'm ready to begin the treatment. So for today, what I've got is a piece of gauze that I'm going to submerge in cold water. So here I'm just going to use tap water. I'm going to pour it into my basin and then I'll add some ice. So in here I've got my cold water and ice. I'll put my cold pad in here, put on some gloves. I'll place the pad underneath my client. Wring it out, and then I'm going to place it on the area in which I want to do my treatment. Unlike heat therapy, I'm not going to wrap this because I don't want anything to heat up underneath. Rather, I want the evaporation process to create more cooling to that area. I'm going to set a timer and I'm going to come back in 5 minutes and I'm going to reassess the area. I'm going to peek under here and see if it looks less red, because typically with a cold therapy it's going to reduce edema, reduce circulation and redness to that area, and hopefully decrease pain. If my pad has warmed up, I'm going to resubmerge it in my ice water, wring it out and reapply. So I'm going to do this every 5 minutes for the completion of the treatment. So you're looking at about 20 minutes in total. Once your treatment's complete, you'll remove the pad, dry off the arm or the hand, and do a reassessment of the skin. So what you're hoping to see is decreased redness to that area. Hopefully the patient's saying that the pain has been reduced in that area. You don't want to ever see like increased pallor or a very whiteness to the skin. You would hate to see any damage to the skin, such as frostbite or hives or anything like that. Once I've done my assessment, I'm completed the treatment, I can go back to the client's record and I can document this in their interdisciplinary progress note.